Hi, my name is Eilidh Geddes, and I'm a health economist here at Northwestern University. Today, I'm going to tell you about my research, looking at how where you live can affect the price that you pay for health insurance. So, health insurance is really important to have in this country, but can be a real pain to buy. Quite frankly, it costs a lot. And prior to the Affordable Care Act, if you weren't able to get health insurance through an employer, you'd have to call up an insurance broker and answer a ton of questions about your health status, just so they could tell you how much it was going to cost. If they didn't like your answers to their questions about your health, they might just decide to not sell you insurance at all. To address these issues, the ACA, or Affordable Care Act, introduced a system called community rating, where insurers aren't allowed to charge you different prices based off where you live or based off your health status, but can charge you different prices based off where you live. For example, here in Evanston, a healthy 27-year-old making $55,000 a year can expect to pay about $290 a month for middle of the road health insurance coverage. But take that same 27-year-old and move them to Springfield, Illinois, a much smaller city surrounded by rural areas, where they'd have to pay an extra $100 a month for about the same coverage. What areas get grouped into a community where the prices of health insurance are the same is a choice that state regulators make. And different states have made different choices. These choices matter because they affect how much people have to pay for insurance and what kinds of insurance are available for them to buy. And so what I study is, are there better ways to make these choices? So the way that these choices work is first, states group counties into markets. They could do this by grouping each area into its own market. So we could have like a Cook County market where Evanston is, and then a separate market for Springfield, or they could group them together. Once they group them together, insurers decide where to sell insurance. They don't have to sell to every county and within a market, but if they do, they have to charge the same price throughout. So insurers get to set their prices with the restriction that they're the same throughout the entire rating area. And so this is going to create some trade-offs. As these areas get bigger and bigger, prices are going to become equalized across geographies. You might be thinking, it's just not fair that someone in Springfield has to pay so much more for health insurance than someone here in Evanston. And so you could group them together into a single market. But this might not be great for people in Springfield if it's just more expensive to provide insurance there, and insurers decide just not to sell insurance to anyone in Springfield at all. It also might not be great for people in Evanston. If prices have to be the same, this might mean that prices in Evanston go up after we group these markets together, and that might be bad for us. So what I do in my research is I try to quantify these trade-offs and develop methods for evaluating what different policies would do to these markets in order to make buying health insurance hopefully just that little bit less painful. Thank you.